Good afternoon, everyone. I'll talk to you about laser vaporization of the prostate, our initial experience at Aga Khan University Hospital. Next. So there are various types of lasers that are used in the market. There is red, green, and green light. And usually this is done to relieve obstruction due to BPH. Now this is a new modality which has been introduced in Aga Khan, I believe as from the start of mid-2013, and we present the experience up to December 2013. So our areas of interest were length of stay, overall cost, symptomatic relief, and time to catheter removal. Now, the mean age of the patients was 69 years, a maximum of 78 and a minimum of 66. Next. The comorbid conditions, 67% of the patients had hypertension, 50% had dyslipidemia, 17% had dementia, CCF, and some are not assessed. Next. The indications for surgery as indicated in the file was the BPH, majority was blood outlet obstruction, and 33% was retention of urine. Now, we try to look at the number of patients who had previously been on medical management. 33% were on medical management, 67% were not, and those that were on medical management, the 33% were on GnRH. So we looked further into the time it took to do the operation using this new modality. The mean time was 83 minutes. The maximum time one of the cases took was 193 minutes, and the minimum time was 40 minutes. Next. In terms of fluid use, I tried to quantify the cost of saline and water for injection. In one of the cases, glycerol was used, but this was because there was a conversion to the conventional TURP. Next. We then looked into immediate complications. 33% of the patients had hematuria, 33% equipment failure. And this equipment failure was a break in the probe, the laser probe. 17% had pulmonary edema and opiate reaction. Two of the patients required immediate suprapubic cystostomy because it was not possible to catheterize them after the operation. Next. Then I looked at the change in hemoglobin. There was an average drop of 0.3 grams per deciliter after the operation. Okay. Next. Then we assessed the days to removal of catheter and the length of hospital stay. So the mean number of days to the removal of the catheter was 2.33, and the length of hospital stay was 2.83. There was a strong correlation between the length of hospital stay and the cost the patient incurred. Next. Now, in terms of cost, we quantified it into three: the cost of theater time, the cost of fluids, and the cost of hospital stay. So the mean cost of fluids was 11,886. And you can see that's the bottom line on that graph. The cost of theater time was 53,084. That does not include the surgeon's fee. And the average cost of the hospital stay was 263,877. Next. So I tried to do a cost comparison between the laser, which is a new modality, and the one that has been used before. In terms of the amount of normal saline used, the average for laser is about 15 liters compared to 27 liters for TURP. And the theater time is about 83 minutes compared to 45 minutes for TURP. The length of hospital stay for laser is 2.5 days. For TURP is 4.8 days. But again, today we had a presentation from Jordan Hospital, so I just included some of that data here. And if you look at the laser TURP, the normal saline used is almost equivalent, but the cost at Jordan Hospital is 825 shillings. And in terms of theater time, it takes 45 minutes to do that procedure, and the cost is 8,500. So next. So in conclusion, in terms of length of stay, patients spent half the number of days in hospital after laser prostatectomy versus TURP. The relief of symptoms is achieved sooner after laser treatment. The time to catheter removal is shorter. However, the overall hospital stay cost is the same.